This is chapter 20 and its focus is on delegation. We're going to try to stay focused on the role of delegation from a nurse manager, nurse leader perspective. I think this slide does a good job of giving you an overview of what delegation looks like. It is important that it is directing the performance of one or more people to accomplish organizational goals, that the opportunities are stretching or a growth opportunity for the person that's being delegated to. It increases the power not just of the leader but also the person who's being delegated to. Nurse leaders cannot delegate total responsibility. They do not delegate responsibility without authority. And what that means is you can't delegate a task to somebody but then not give them the authority to do that task. And you don't want to delegate only boring jobs. So I think this is a good overview. When nurse managers delegate, it frees the manager to handle problems that are more complex or require a higher level of expertise. Sometimes others are going to feel better prepared or have a specific area of expertise to accomplish a task that maybe is not in the wheelhouse of the nurse leader. It's important to delegate things that are an opportunity for our subordinates, but when we delegate the responsibility, we have to make sure that it is something that they are qualified and licensed to accomplish. I want to remind you that when we do delegate, that it increases the power of the person who's delegating it because it does demonstrate authority, but it also increases the power of the person who's receiving the delegation. It allows them a new opportunity to do new things and to demonstrate professional efficiency. It's important to be able that nurse leaders say no when we have to, and that goes both ways in someone wanting a task that can be delegated and your professional leadership opinion is that they're not the best person to receive the task. But the decline also goes when you are being delegated to. There are going to be times that you're asked to do something that may not be appropriate or may not be within the scope of practice. So we do need to use good judgment and be willing to say no when it's appropriate. Delegation is not just necessary, is necessary. It's not optional. When there's too much work to be done by one person, delegation becomes synonymous with productivity. Delegation is a major skill that has to be learned. It is a frequent mistake by new nurse leaders that they feel like they have to do everything, so they under-delegate. And this causes a lot of role exhaustion that can be prevented if proper delegation is used. When we think about clear communication and delegation, it's important that when you delegate that you define the task clearly, and that you delineate or explain the end result, time frame, and standards. You do not want to make the mistake of telling the person exactly all of the steps that they need to follow when you've delegated a task. You just need to tell them the end result that's expected. You need to give them the professional autonomy of going about the task that's been delegated in their own way. You also want to delegate the objective, not the procedure. So if you are going to delegate to your unlicensed assistive personnel or your certified nursing assistant that you want the patient turned every hour because there is a stage 1 pressure ulcer on their hip. So instead of the routine every 2, you've asked them to turn the patient every hour. The end result is that the patient is turned every hour. You're not going to go in and tell them where to put all of the support pillows or how to adjust the height of the bed or the legs of the bed or how to fix the linen so that there's no additional pressure. You're going to trust that person to follow their own best practice and their policies and procedures for the procedure and the process, but you are going to make clear the expectation, which is that the patient will be turned every hour. This is the 5 rights of delegation. You do need to know this. NCLEX is going to ask you, and you'll see it in multiple areas of testing, so I want you to be familiar with this. I want to remind you that the 5 rights of delegation align with the American Nursing Association's standard on safe delegation, so it's important to connect the ANA with the 5 rights of delegation. Tasks that cannot be delegated. Patient assessment, planning of care, implementing patient care that requires judgment, health teaching, and the evaluation of a patient's response. All of these things cannot be delegated. This is a list of things that can be delegated, but that require special credentialing. So a sterile procedure, think about the OR and how many non-nurses do sterile procedures. Those people have been specially trained. Invasive procedures, again, those are specialized areas of care. I don't think medication administration, I think, sometimes throws us, but there are med techs that exist within healthcare systems. Nursing homes often use these. The Veterans Hospital uses medication administration techs, and there's some home health companies that do as well. And these other two also require special training. These are tasks that are commonly delegated. Again, it's important that when you do delegate these things, that communication is clear and the task that's to be done is clearly defined. It's important that not only are you clear in the task that needs to be done, but that the authority that is required to do the task goes with the person that has received a delegation. So, for example, if you chose to have one of your team leads create a committee and work on revising a policy or procedure, you would want to give the authority to the team lead to coordinate with staff members, maybe adjust schedules, make appointment times, find flexibility in everyone's meeting, and being able to pull together a group and actually work on a policy and procedure revision and give them the freedom and the authority to command a committee. It's important also that when delegation occurs, that no one is delegated an assignment or a duty that is outside their scope of practice. And it's important for unlicensed personnel never to be given a task that requires nursing judgment. And this includes assessing, teaching, evaluating, administering medication, unless they've been specially trained, and any care of an unstable patient. That's a pretty good bucket list of things that really require nursing judgment, and those should be avoided for delegation. It's important for nurse leaders to remember that prior to any delegation, they need to carefully assess the skills and the knowledge of whomever they are delegating to. They are responsible for the delegated task, so it's important that it's delegated appropriately. This is assigning the care to the LPN. I think you can read through these. The important thing is to remember that a registered nurse has to initiate the care plan, that the registered nurse has to do the initial assessment, that the RN has to do client teaching and evaluate outcomes, that an unstable patient cannot be assigned to an LPN, and that there are legal limits of delegation to LPNs and that they vary state by state. So it's important for you to know what those variations are in the state that you're going to practice in. Delegating to an unlicensed assistive personnel, these are the potential costs. So you have the concern for liability for negligence, issues related to the tasks of delegation, and the responsibility for the patient outcome. The general gist of this is that a registered nurse can be liable if there was negligence in the supervision of the employee at the time that an error occurred. So again, that goes back to making sure that your unlicensed assistive personnel are properly trained, licensed, and within the scope of practice to do what you're asking them to do. If they are not, even if they agree to do it, ultimately you are responsible. Unlicensed assistive personnel, remember, can complete tasks, and that's to include like vital signs, INOs, and other indicators. But nurses need to analyze data that leads to comprehensive care and assessments of outcomes. Nurses are responsible for the assessment, the diagnosis, the care planning, and the evaluation. That's the nursing process. We're responsible for that, and we cannot delegate that. The unlicensed assistive personnel can perform simple interventions related to hygiene, nutrition, elimination, or activities that the registered nurse remains responsible for. Again, I want to remind you that if we are properly assessing the skills of the person we're delegating, we're aware of their scope of practice, and we provide the proper supervision, you're less likely to have concerns with errors from an unlicensed assistive personnel. When you think about accountability, I want you to be thinking about this as a right and left side. Registered nurses are accountable for their active delegation, the supervision, the assessment and follow-up, as well as interventions or corrective action that need to be required. The delegate, the person that's receiving that delegation, is responsible for his or her own actions, for accepting the delegation for a task in which he or she is not trained. So if the individual accepts a task that they know they are not trained, they have a responsibility for that. Communicating appropriate information to the registered nurse who's delegating it and completing the tasks. When we say completing a task, I want to remind you that we're going to complete the task following an established policy and procedure within their scope of practice. Very often nurses have resistance to delegation when they feel that when they are concerned that what they're going to delegate will not be done. And most of the time, the person who's receiving a delegated assignment, if there is resistance from being delegated to, oftentimes it's because the person who's being given a task to do may not feel like the person that's delegating fully appreciates that person's workload or their expertise or what's being required of them. They basically feel put upon and feel like they're being burdened when they're being delegated to. So having a reciprocal relationship where the nurse really does convey an understanding of the work responsibilities and duties of the unlicensed assistive personnel goes a long way to make them feel valued and make them feel understood. So when a delegated task is done, that they feel like the person delegating the duty gets the whole picture and understands their work responsibilities. Common delegation errors: underdelegation, overdelegation, and improper delegation. Underdelegation's most common cause is that the leader has a need for everything to be done perfectly in their own way. They have control issues, and that's a polite way of saying it. Sometimes they underdelegate because they love that part of their job. It could be that they lack the skill of understanding proper delegation. Sometimes it's that they want to control the outcome. They want it done a certain way. Most of the time, it's the need for everything to be done perfectly, and they don't have enough trust with their team to be willing to empower their team to learn a new skill or do something that may or may not be exactly the way the nurse leader wants it done, but still would grow and empower the team. Overdelegation is often a result of poor management on the nurse leader's part and an insecurity of the nurse leader to do certain tasks. Oftentimes when they overdelegate, they're giving things away that they don't know how to do or are fearful of doing, or they're just overwhelmed with things and they start offloading things off their plate indiscriminately and create people being faced with circumstances and situations of being asked to do things that they're not properly trained or licensed to do. Improper delegation comes back to being the wrong time to the wrong person for the wrong reason, and that goes back to not fully understanding the person that you're delegating to, not fully assessing their skills, understanding their scope of practice, or even their work responsibilities. And improper delegation can become a liability issue and cause some legal issues if it's not done properly. It is really important for nurse leaders to remember that when we're delegating, we need to delegate appropriately. And when we're delegating, we want to really think about the growth and opportunity of the person who's accepting a delegated task. We do not want to offload things that are unpleasant. We don't want to delegate things that we just don't want to do. Sometimes we need to delegate our favorite thing to do, our task that we really enjoy or feel fulfilled by, so that others can learn and grow. That's a responsibility of nurse leaders, is to think through what they're delegating and make sure that what's being delegated is appropriate, but also a learning and growth opportunity for the person that's doing the task. You're going to monitor any delegated tasks. Again, that goes under the auspices of providing proper supervision. You want to, again, make sure that the person that's doing the task is using it under the proper scope of practice. You want to be available to answer questions and to guide the person accomplishing the task. What you don't want to do is rescue someone who's struggling with a delegated task. That when we go in and we swoop in and we say, okay, well, obviously this was too hard for you, let me just do it, we're robbing them of the opportunity to be successful. We want to be there to guide them, to troubleshoot them, to offer feedback, to maybe even narrow down some options. But again, we want to avoid going in, swooping in, and taking back a delegated task for fear of their failure, for fear of their wandering, for fear of their anxiety and worry. We want to help support and nurture people who are experiencing a delegated task for the first time and are learning their way. That really is appropriate mentoring and coaching from a leadership perspective. And we do want to give people challenging opportunities to do things that are appropriately under their scope of practice and their skill level. So we want to stretch people, but we want to stretch people legally. Delegation is a function of the professional nurse. I think this is pretty straightforward. Again, it goes back to just remembering that nurses are accountable for all the care that is provided that's been delegated. They're still responsible for a delegated task, and the nurse's responsibility is to make sure that the care provided meets or exceeds safe practice standards. So if I delegate turning my patient to a nursing assistant, then I need to make sure that the care that nursing assistant is providing to my patient while they're being turned every hour is meeting or exceeding a safe patient standard. And part of that is going in and properly supervising your team, properly providing mentoring and supervision, making sure that you're delegating to the right person with the right reasons and the right time. Again, that goes back to remembering that when we are delegating to the other people on our team, we don't absolve ourselves of the responsibility and accountability of the outcome. So we do need to stay engaged and involved. This is a quote from your author. I think that's pretty straightforward. You can read that. And then this is addressing the cultural phenomenon when delegating to a transcultural team. Again, I think this is pretty straightforward. I know that you probably feel like there's a lot of repetition in this slide, and that's because there's a lot of repetition in this slide set. The big things to take away are to remember what can be delegated to whom and at what time, making sure you understand the 5 rights of delegation, and that you really have an understanding of what requires nursing judgment and when it does that we can't delegate it to a unlicensed professional. This is a Quizlet that is designed to be matching. If you click on this link, it will take you to the Quizlet website, and then you're going to click on the icon that's at the top that says match, and you're going to it'll open up a screen, and you're going to match some tasks as to whether they can or cannot be delegated to. So I do want you to do this quiz. I'm not delegating, I'm directing. You need to do this. This gives you a little bit of practice in doing something online that we would do in class. So I do want you to do this and play the game for a few minutes, and it'll give you some practice. I hope this has been enough information, but not overwhelming, to give you a reminder of what delegation looks like. Ask questions in class next week if anything comes up. Thanks.